Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and George Andre.
Hello, everyone. Today's guest is Dr. Laila Hishaw. Dr. Laila is a fellow American dentist, a board-certified pediatric dentist, and the founding partner of the Tucson Smiles Pediatric Dentistry in Tucson, where she lives with her husband and 3 children. But she recognizes that she is more than a doctor who just fixes teeth. She's a role model and mentor to children and future dentists. Dr. Hishaw is one of only 3.8% of Black dentists in America and strongly believes that representation matters and that children will want to emulate what they see in their lives. She decided something needed to be done to change these statistics, and her passion project has grown into a nonprofit organization. Dr. Hishaw created the Diversity in Dentistry Mentorship to educate, empower, and mentor African American youth and other underrepresented minorities in dentistry. Her goal is to show them that dentistry is a rewarding career and an attainable goal early on in life, getting them on the right educational path to be successful candidates for dental school and ultimately valuable leaders in dentistry. Me and George Andre wanted to talk with Dr. Laila because our reality is, we don't hear much about diversity in dentistry here in Europe. And we questioned, is there a diversity problem in dentistry? How will increasing the diversity in dentistry impact the dentist's life and the communities they serve? And how can we, dentists, can be coached to create a more inclusive and diverse work environment in dentistry? Dr. Laila answered all our questions, and we think this is a very valuable conversation to bring awareness to dentistry and also to show how we, dentists, can be so much more than doctors who just fix teeth, like Laila said. We can have a significant impact in the community. We hope you enjoy. So welcome, everyone. Welcome to another episode of the Soft Bites podcast. And hello, George Andre.
Hello.
And today we have a guest with us, Dr. Laila Hishaw. I already introduced her in the intro. And welcome, Dr. Laila. Thank you so much for joining us and for giving us a little bit of your time to talk to us. We are very grateful to have you. And like I said, I already introduced you in the intro, but tell us a little bit more about yourself, why you chose dentistry, and a little bit about your journey in dentistry.
Oh, well, thank you. And thank you, of course, so much for inviting me to be on to your podcast. I love the message that you're sharing, really just being there to elevate the leaders of dentistry and how we are leading our teams and caring for our patients. So I think it's a wonderful amalgamation of different subjects that we can all glean from and learn from. So it's a great honor to be here. But yes, you've reached me here in Tucson, Arizona, in the southwest of the United States, by way of Kansas City, Missouri. That's my home. But before that, I was actually born in Tehran, Iran. So I have to, when anyone asks about my journey, many are surprised about my background. So my father was Persian, and he's passed on now, but he was also a dentist. But I'll get into that part of the story in just a sec. And my mother is African American. She grew up in Kansas City, Missouri, in the central part of the United States. But yes, I was born there at the time right before the Iranian Revolution. So I actually didn't get to grow up in Iran, and we left when I was about 5, and my father stayed there. So I didn't really get to see him as a dentist, growing up as a dentist. When he would come visit in the United States, it was always the fun. Let's go to the amusement parks and all the fun things and watch me ice skate or, go shopping, all those things. So I was raised in a single parent home with my mother. My grandmother also helped out a bit, really being there to have a warm meal on the table. But as a single parent, my mother had always instilled in me that she wanted to make sure that I entered a profession that was rewarding, yes, but that also I could take care of myself. I think the struggles that she went through working two jobs, she was a teacher, and thank goodness my grandmother was there to help. But that's why the seed was planted early that I had to be a doctor. So we go through this whole path, and I was like, I know I had to do it, but I was majoring in sports medicine at Pepperdine at university. And I knew I didn't want to be a doctor. I didn't want to be a physician. I knew I didn't want to do that. But it wasn't until after I graduated and started to explore some other things. And it was the first time that I actually got to go back to Iran for the first time since I was born after, in my 20s. And I got to see my dad working as a dentist, and he was a prosthodontist, and all the art that he was creating. And he also taught part-time. And I just fell in love with it. I said, this was my calling. So that's how I got to dentistry, a little bit around the way. But, all our journeys have an arc and different paths. And I think that's part of just the lessons in life that you learn along the journey. And I'm glad I found it that way. And so pediatric dentistry was just a natural for me. I was the oldest of two sisters by 9 and 10 years older. So I kind of was the fraternal sibling. Like I helped my mom out. I drove them to school and to dance practices. And I also loved being a school a summer camp counselor. So I was always around youth. So I love the children. And then when I was in dentistry and started doing the rotation, pediatric dentistry was just a perfect fit. I love the speed of it. I love the medical aspect in that, learning about the hospital and anesthesia and the sedation and the speed was great too. And of course, just the kids and the personalities. I mean, hands down, that was why I decided to be a pediatric dentist. And so I met my husband, and he was doing a residency in neurology and psychiatry. And there's only a few programs in the United States that had a combined program. And one was here in Tucson, Arizona. So we've been here ever since I finished my residency in San Antonio, Texas. I moved here to Tucson, Arizona. So, wow, it's been like 22 years since we've moved and started as a pediatric dentist. And now I have a private practice. We have multiple locations, and I'm in a partnership with one of my associates who bought in early on back in 2006, and we've just grown it to have 2 practices now. So it's busy, but it's worth it.
That's very good.
Thank you.
Laila, we don't hear that much about diversity in dentistry in Europe.
Mhm.
Is there an issue of diversity in dentistry, and when did you start to think about diversity in dentistry?
Oh, well, it definitely is an issue because for the last 15 years, there hasn't been there's been pretty much a flat growth of the number of Black dentists and in the dental workforce. But to back up a little bit, I guess I wasn't really realizing that there was still an issue. When I was in dental school at the University of Missouri in Kansas City, I was there between 96 to 2000, and I was one of 4 Black students, and there was actually just one Hispanic student in our class. And I after graduating, and then it was going to residency, and then after residency, I was moving. I actually moved, got married, and started a practice all in the same year. So busy, nose down to the grind, just working and working. And then it wasn't until 2018 that, I just realized after the latest numbers came out from the American Dental Association on the racial diversity in the dental workforce. And so African American Black in the population make up about 13% of the population, but only 3.8% in the dental workforce. So you can see that there's a disparity in the racial and ethnic makeup of the dental workforce. And the numbers are very low for Latinx, Hispanic, and also Native Americans and Alaska Native. And they're less than 1% represented in the dental workforce. And so it was just a shock. I just didn't realize things had not changed in over 2 decades. And so I'm sure we'll talk a little bit about the mentorship program and what I started. But the problem is when the dental workforce does not mirror that of the population, we don't have caregivers in these communities that need them. And so communities of color are lacking in many access to care. There's a disparity in the healthcare that they do receive, the cultural competency. And there's good data that shows that dentists of color are more likely to go back and serve in those communities. And so that's why it's a problem. And as Jenna said, we all take an oath to, serve the public and do no harm. Is really important for all of us to realize that there is a need to strike a balance in our dental workforce so that all patients can have great health outcomes and optimal care and equal equity in the access to care. So that's why it's important. And, after I saw that statistics, I was just shocked. And I was like, that's crazy. And it was just an impulse that I went over to my public Facebook page and I just put out a post saying, hey, this is the statistic right now. Whose kid can I mentor? Like, I'm sure if we can get to these kids and let them know you too could be a dentist, it may be hard for them. Well, it's not maybe, it is hard when you don't see other professionals that look like you that you can think, oh, well, that's a profession that I should consider. And I will also say in schools, the middle school, high school level, a lot of time these college counselors are not suggesting careers in dentistry to students, let alone students of color. And it was really that Facebook that was just the spark that ignited this, I guess I call it like a movement of mentorship. Because I think all of us as dentists, we want to help. I think having this discussion helps bring awareness around it. But then I get the question of like, well, how can I help? Like, what do I need to do? And so that is what I'm trying to get the message out. So thank you to let me share that because mentorship is all the difference. It just inspires opportunity and hope. And I think it's going to make a difference.
Laila, just a question. Do you think those numbers are also as low as you mentioned in medicine or in dentistry? They are even lower than...
They are very similar to a medicine. And in fact, with dentistry, always is kind of lagging just a little bit, but follows the same kind of pattern of medicine. But actually, it has been stated as a United States health crisis about the lack of Black male physicians now. In fact, their recent data show that there's less Black male students entering medical school now in 2024 than there were back in the 70s. And so the question is why? And, and then the solution is how can we get to them and let them know that, yes, let's help get you on the right path and help guide you so you could be successful in medicine and in the oral health profession. So definitely it's a problem in medicine. And it's important, when we're talking about oral health outcomes, you can see in medicine the way there's a lot of bias that physicians aren't aware of that can affect their treatment planning, their diagnosing. I'm sure we can talk about a little bit later. There was even a study that was done for dentistry that showed that, diagnosing a tooth with irreversible pulpitis, and everything was constant that for the subjects the dentist to look, they had the same radiograph, they had the same intraoral photo, they had the same, complaints and everything. And the only difference was that they knew the patient was either Black or the patient was white. And the number was significantly higher for the dentist to diagnose an extraction of that same exact tooth for a Black patient versus recommending a root canal for the white patient. So we do know that these health disparities occur because of the bias and the lack of representation and the lack of education and cultural competency.
That's that's so interesting. And it's like we said in the beginning, it's not something that we are aware here, that we don't discuss much here in Europe.
Right.
I guess you already answered, but I will ask you again if there is any other aspect that you want to share with us about how increasing the diversity in dentistry impacts not only the dentists' lives, but also the communities they serve. Because I think that's very interesting what you said. So by you enabling the dentists, they will go back to their community and they will work on their communities, right?
Yeah, it makes a difference too, and I'm sure just for you as well. Yes, you're seeing your patients and serving them and building a practice, but as a business owner, you're giving so much to your community. I'm sure you're sponsoring a lot of things that your patients. For us, of course, in pediatric dentistry, I'm always getting a sponsorship for the schools or backpacks and back to school sports, soccer teams, and things like that. But you are also employing people into your practice, so you're elevating your community of where your practice is, and that is so important for these communities to bring dentists there to serve and also to serve their patients, but also serve their community and help increase the livelihood of those who are employed by them, opportunities, health insurance, benefits, 401k. I mean, we do so much as dental leaders. And even if you don't own a practice, having a dental organization or a group practice in those communities and they employ dentists, you still are looked upon as leaders in that community. So it's just so important. And I think it's just that my goal in our nonprofit, which is Diversity and Dentistry Mentorships, is because when I first talked about the Facebook, I put out the post and then I got a lot of people like, yeah, I want to be mentored, or will you talk to my son? Will you talk to my granddaughter? But from that, it's grown into the nonprofit, and the nonprofit is really underlying the bottom line message is we're just trying to increase the applicant pool of applicants from diverse backgrounds who are historically underrepresented, right? There are different racial and ethnic minority groups, but when we talk about the historically underrepresented groups in healthcare, they come down to those that I mentioned earlier: Black African American, Hispanic, Latina population, and the Native American and Alaskan Native populations. They are underrepresented based on the number of groups of their representation in the population. Okay, so if we are trying to increase the applicant pool, that means we got to reach to these kids younger. And so we've put together this really exciting youth summit to bring in middle school and high school students to really experience the day in the life of the dental school at the dental school, right? And so they get to get a kind of crash course in dental anatomy. They get to be in the simulation lab and work with the instruments, maybe put in a composite resin, take a look at the intraoral camera, taking some impressions. And then we have a panel discussion. So these students can ask questions about, well, what do I need to do? What should I major in when I go into college? Or does it matter that if I major in a science, how did you pay for dental school? I mean, these are some barriers that these students in these communities have, because again, if we're just a small representation of dentists, they don't really have a lot of people to look to ask these questions. And I tell my colleagues, you don't have to be, as a mentor, you don't have to be from a historically underrepresented background. You just need to share your values with your mentee, align with them, and just be there to encourage and guide them. And so if we can get to them early and get them on the right path, get them prepared, mentors not only do that, but they support their emotional and academic success, right? They can help them on how to prepare for an interview, how to edit their personal statement, It's just so many things we don't think about and maybe we take for granted, but these students need. And and so that's our goal for our middle or high school students is for them to get exposed to our profession, to promote our profession in that way. And then for students of color who are pre-dental students, they're in college, they're university, and they know they want to go to dental school. But again, they don't have those resources and that community of network of community to help them. That's where our mentorship will serve them because again, they will maybe help pick up the phone and you might have a mentor in one part of the United States and you're on the other coast. But I have a classmate. I went to dental school that's in California where my mentee is. I can pick up the phone and say, hey, I have a mentee who hasn't had any shadowing hours. Would you mind if they could come in for a half a day and shadow you? That's so much easier having that warm introduction than a student who knows no one, doesn't really know their dentist that well, to have to cold call, like pick up the phone and ask if they could come in. Because we are just trying to make sure that they are building this really strong portfolio so that they are strong candidates. And I always say in other interviews too, I'm not just saying that we need to increase the diversity by just selecting anyone to come into the dental school. But the problem has been with the bias and systemic racism is that they think that there aren't any competent students from these backgrounds to select them. And that's just not true. They have the grades, they have the test scores, but maybe they just weren't given the opportunities to come in and get shadowing, or maybe they didn't have the resources to take a very expensive DAT prep program that's cost thousands of dollars to help boost their DAT score. And they come at a disadvantage where they don't have that as much. So we as mentors are trying to kind of break down those barriers and help promote them into the profession by being, really, really prepared and confident as they go into the application cycle.
So Laila, how exactly does the mentorships work? I mean, I see you have a website and you can log in or you can enter as a mentor. You can find a mentor or you can become a mentor. So do you actively go to these communities or do you promote the website so that these communities come to you? How does that work exactly?
Oh, great. Well, thank you for asking. And I will tell you, we started my passion project, let's call it, in 2018. And it wasn't until 2021 that we actually got our formalized nonprofit. It was incorporated. So in 2021 was the first year that we did our youth summit here at the A.T. Still University Dental School, Arizona School of Dentistry and Oral Health. And so we're able to reach the youth there at our youth summit. Now, as far as getting to be a mentor, our website is the place to start because we have mentors across the nation. And our mentees are found through our social media pages and other mentees. We've also recruited some of the students who attend the ADEA conference, the American Dental Education Association has like a recruitment fair every March. And so we go and let them know about us there. But as far as the colleagues, when they come to our website, and you can click on there to be a mentor or to find a mentor, there's just a few questions that we ask. And then we go and we really do pay attention to how we match them by the questions or the responses that we get to the questions. Are they looking for someone who can help them with a personal statement? Or are they looking for someone to actually just help them in study skills or professional development? Or are they looking for an orthodontist that they know deep down their heart they want to be orthodontist? And so we try to look at that. We look at the region. As we're growing and applying for grants, we're using some of the grant money. And if I can, the website is diversityindentistry.org, diversityindentistry.org. But as we're raising money, and this is a nonprofit, no one's getting paid. This is all out of love and passion for this commitment to doing this. But we need donations. So you can also donate on that website as well. But we're looking to get these platforms that will help us on just making sure that the mentorship relationships are consistent across the board because, we want mentors to feel like they're equipped on what they need to do. Me being out of dental school for over 20 years, I really had to go back and educate myself. It's a lot different now, the application process. So we give them a handbook, a mentorship handbook when you become a mentor that kind of gives the timeline of when the application cycle is, some of the resources for them to prepare for the DAT, and just ways on how to communicate and log their visits with one another. We really leave it up to the mentor and the mentee on the cadence of how often they'll want to meet. They want to meet once a week briefly by text or get together on Zoom or FaceTime once a month. It really just kind of depends on where the mentee is and what they need at that time. But as far as how we do the matching, we've started to implement a cohort system and a cycle of matching. So we have just matched for the spring, and we do it for a 6 month kind of semester block. And that makes it an easy way after 6 months to say, hey, did this relationship really work? Is there something I needed that I wasn't getting? Or get that feedback. And when we hope to get more money and use these platforms, they will allow for the automations on check-in or, okay, your student is now in 10th grade. Have you started talking to them about when they're going to register for the DAT? And that is what we wanted to do to really keep everything flowing in a smooth and effective way. So so a lot of it right now is that when if you're not matched with a one-on-one mentor right away, we do offer to the entire public. So you could be part of the majority group or the dominant group as far as racial ethnic background and view our webinars that we have monthly. And these webinars are on our YouTube channel. And they're great because they talk on things of how to budget for dental school, how to pay for dental school, which programs are most effective in studying for the DAT, even which study skills are most effective. And it's great because we actually, on those webinars, the monthly webinars that are free and up there, a lot of recordings, we invite dental students who are already in dental school to kind of share their experience and their recommendation. And it's great because that's what we call the peer mentoring. They're closer in age, they're closer into the journey of where our mentees coming in. I mean, it's great to have me and others who have been out and in the workforce for several decades to share our social network. That's and our social capital. That's really important for mentees to pick up with the phone. It's like, hey, my friend is applying, and they come in and all that kind of stuff to visit the school. But the peer mentoring is where I think they really have a better connection with one another, and they're truly inspired. Not only inspired, but they are empowered after hearing them and learning from them.
So by what I understand, you try to have connections with students still during their high school, right? Before the university. And how exactly do you do that? Do you select dental schools? Do you do it locally? Do you do it nationally? How is that process?
Well, with the youth right now locally is in Arizona. When we have our youth summit, they're always invited. If after the summit, and we've seen, we assess them too. We like our metrics. So when these high schoolers come in, we ask them a series of questions. Have you ever thought about being a dentist? Do you have a dentist that looks like you? What are your thoughts about dentistry? And I will say there was like a 99% rate of those at the post-summit assessment after they finished a hands-on experience and talking to the dentist and the dental students. And we asked if you would consider a career in dentistry. 99% of them said yes. So that's great. So we kind of reached out to them and let them know that if you're interested in staying on and continue as a mentor, to let us know. And so those are all done virtually. But I guess I didn't make that clear. The one-on-one are a virtual mentorship. If it works out that we've matched someone in the same city that they can work together. But because kids are under 18, we like to stress to do a virtual mentorship unless we're together in the group in a youth summit just for, all the safety stuff. But for the dental students, it's a virtual mentorship unless they're in the same city with the mentors. Maybe they come in, like I have mentees who come in from the local university here and they're shadowing me. So I'm mentoring them as they're here.
Lily, do you already have the metrics of the impact of your program, of the mentorship program?
Yeah,
can you already measure the impact in the?
Yeah, so we just with the youth summit, those we're following. We haven't been around long enough to follow the high school students through college to dental school, and I can't wait to be able to give you numbers. I'll be back in a few years. But the students who are matched up with our mentors who are applying to dental school, I don't have the exact number, but we have so many schools that they have been accepted to. So currently, right now, we have about 175 mentees, 175 mentors, and we have about 325 mentees. You can see where there's a little bit of a discrepancy there. We need more mentors. And so that is why I try to share the message to let you know that anyone can be a mentor. We really can help guide you. These kids do not care what background you're from. Like I said, they just have to know that you care about them. You're going to be there to really guide them, be their cheerleader, empower them. We can't just discount how impactful just a simple word of saying, you got this, you can do it. Because there's a lot of things, setbacks that happen. Maybe they didn't get the DAT score they really wanted. But we got to let them know not to give up. This is and we know anything that's worth anything, it takes a lot of time and it takes a lot of, tears sometimes. You get up and hit the wall many times, but we don't want them to get discouraged. There's a lot as well on these, some students, some of their family backgrounds, they may not be as supportive. And they're finding almost a new family with our mentorship group because we're here to say, yes, you can, versus maybe a family member seeing the sticker price of dental school and they have no money to be able to put them through school. It's like, oh, that's ridiculous. There's no way. Why would you do that? It's going to take 4 years when you can have a job right now, but not really understanding they can help the family more if they get this professional education. Yes, there will be loans, but sometimes there's a lot of scholarships that people don't even realize. And we do give a resource of scholarships to them too. And in fact, we're starting a scholarship program if they are a mentee with us monthly based on the corporate sponsorships that we give. We give a portion of their donation to these scholarships that just don't give up. And that's why kind of our tagline is, we did it, so can you. And the did is for diversity in dentistry. We did it, so can you, to let them know that it's possible. It really is. I'll come back with some stronger numbers for you once I get them in dental school.
We'll be here. How can we dentists be coached to create these more diverse work environments in dentistry?
Yeah, yes, we've been talking a lot about students and getting them into dentistry, into dental school, but even in dental school and getting out of dental school, we start practicing. I think diversity is important for us to consider in how we lead. So leading in your practice, or leading in your organization or your group practice, or perhaps your education and how you're leading in your educational institution. Communication is so important, but I think before we talk about that, an awareness of self-awareness. You guys have so many great episodes on emotional, intelligence, right? The EQ. We have to be self-aware. And one thing, I think people think bias is a bad word. Conscious bias is bad. That's when you're being, uh, not racist, but prejudice is word. Well, there's also racism. But as a human, we all have bias, but we have to make ourselves aware of our unconscious bias, right? Things that has formed our thoughts, our beliefs and values that have come from our upbringing, our communities, our families that have just been ingrained in our brain. And we think that is actual fact when we have a bias, which is really an assumption about one. So, as a leader, I think it's important to be self aware of our biases and how we then approach things with our team members from different backgrounds, or not even just the racial backgrounds, but financial, economic, gender differences, educational differences. Diversity is such a big spectrum. I just happen to focus on the racial ethnic disparities and biases and things that we talk about that go and coincide with the work we're doing in the nonprofit, but sexual orientation and all the other things we said. It's important that we take time to be aware of that. And if you, I think if we could just remember that if a thought comes in your head right away, to just pause, it's like, and just ask yourself, like, why am I thinking that? Why am I making an assumption that this employee or applicant who's going to be a dental assistant in your practice, why do you think that she wouldn't be a good fit in your practice? Is it that maybe she wears a hijab and you think that won't work? But why? But why is that? What has the news told you that's not true? And then with your patient, perhaps in the example we talked about with the saving the tooth versus extracting, are you going to think that, well, they're lazy. They're probably not going to take care of it. I'm not going to put that implant in, those kind of things. And that's where we want to make sure that we are aware of these biases, and also in your management, not just dentists, but the managers in your office. When I was talking about the hiring, making sure that there's what we call affinity bias. And I think that's like the most vastly popular one that everyone has, because we all have an affinity to want to be around and hang around people that look like you, right? So are you being fair in your hiring process? And maybe it's time that you get together with your leadership and look at it. And maybe it's important that more than one person is interviewing and bring in a group. Make sure that there's time that you allow your team to give you some feedback. Do they feel psychologically safe in your practice? Can they come to you with feedback, or do they feel they'll be dismissed and not really heard? So there's just a few of the things that we could talk on for days about that. But I think
but it's so important, isn't it? I mean, we all have bias, and I think that's a very important message for everyone listening to us.
And just to know it's not bad. That's the thing. I think anytime we want to have this conversation, a defense wall comes up. Like, I'm not biased. I said, well, yeah, you are. You're biased on the most simple things of, like, how you dress or what you like to eat. I mean, it's just a bias. It's just being aware of it. And so I think that's definitely.
And coming back to the numbers that you gave, that you were saying that there are less people of color in medicine today that there were in the 70s. And while you were talking, I was just remembering, I mean, we see a lot of American series and movies, and it is true that we often see a doctor that is of color, like in a movie about some genius doctor or something like that. And in Europe, we are used to that. We are used to seeing American series where you have colored people as doctors. But why do you think that this number has dropped over the last 20 or 30 years? Why did this happen?
Yeah, I know. I have thought about that too. And I think for the men, so with Black women and women of color, I think luckily, because of the emphasis and empowerment and organizations that have empowered women, this is why we're seeing now in dentistry, we're the majority of women. There's more women than men, 51% women in dentistry. So I think that's part of it.
Yeah, in Europe, the same. In Europe, we have the same thing.
Okay.
Yeah.
No. Yes, but so for the Black men and men of color, I really think it starts early on with the guidance that they're getting, that they're not told that they can think of healthcare as being a profession. So luckily, there's some not new, but other organizations like Black Men in White Coats who do a really similar program, reaching out to middle and high school students, even younger in primary, to let them see physicians that look like them, to inspire them to get on that track, and let them know, that once you get through the process, medicine and dentistry becomes something that's not that hard, right? We've done it over and over. It's just
Yeah.
getting into it. It's like the barriers of applying to school, the money, the admissions test. And so I really think that men have fallen behind a bit because they have not been encouraged so much. It'd be interesting to see, what other professions, like I said, going up in engineering. But I know for a fact in those types of professions, they're still underrepresented number than they are professionally in the population. So knowing that that is a fact, I think we just as a community, and also I think it's the responsibilities of universities to really go into these schools and provide some guidance, some pathway programs, getting them some educational opportunities to learn about it during the summer. There's a summer health professions educational program that many of the schools, but not all the schools, participate in. And the goal is to raise the representation of underrepresented students in the school. So it's dentistry and medicine and nursing. And so I really think is a strong ownership on schools to reach out and make these programs available to these students. Yeah, even my own daughter, my daughter, she's a second year in a college, and she really wants to be an aquatic veterinarian, medical doctor. Since she was 5, she's always wanted to be in the marine sciences, and so now she's doing that, and they've had programs while she's in school. I mean, she was, merit scholar, super intelligent, got to a great university. But still, they were realizing that if we want to keep students like her in this, should move forward the profession into veterinary medicine and also a PhD program because she wants to do more academia research in it, then they have to nurture her. And so they have, and it is really mentorship, really, when we talk about that. She's been mentored by, a lead investigator on the research program that she's doing, like a PI for the research so she can learn about it. And then it's just summer programs so that she can get some teaching experience to her younger peers. So without programs like that, then they're not going to increase the number of Black students in marine sciences. So they're taking an active role in doing that. And that's what I would love to see in our dental schools as well. And we were a recipient of a very generous grant from Delta Dental Institute to scale our youth summit out of just Arizona, but to get it across the nation. And I'm super excited about it. We have one coming up in April where I graduated from dental school at UMKC, University of Missouri, Kansas City. And that's what I want. That's the goal, is so we can bring these summits into these communities. And then it's a win-win for the school too, because the students and their peers are going to see how the schools took time to invest in them, to bring them in, to give them this experience. And hopefully they'll remember that, as they're going to college and now they decide they want to do dentistry, about, that day that I was at that youth summit, I had these dentists who flew in from across the country and these dental students that took their day to really just empower me. And really at the end of the summit, they get this white coat, they get their white coat ceremony. And so when they see how you see their pride when we're putting that white coat on them, I'm telling you, those shoulders go back, that chest puffs out, and they are like, okay, I could get used to this, Dr. Nicole or Dr. Sam. And they can just really see that this is a seed that's been planted, and I'm going to do whatever I can to make sure that I get my own white coat one day. And we actually let them take the white coat home as an official reminder that they can keep in their closet and always remember that day that they were a dentist for a day.
Laila, a more general question. You said that you have several practice locations, right? Um, how do you see the future of dentistry, especially in the United States? And you do a lot of pediatric dentistry. Is it more towards prevention? Is it more towards intervention? How do you see the future of dentistry?
I see the future of dentistry, first I'm from the perspective of a pediatric dentist as prevention. Now with silver diamine fluoride is really, I think, it has been a game changer for us. I remember coming out and if a kid had, uh, baby bottle decay, early childhood caries at such a young age, we were talking about taking them to the hospital and putting them under anesthesia. But now we have a way of medically treating their teeth with a simple drop of silver diamine fluoride that's easily applied. I mean, yes, I wish it wasn't black, but we know we can at least buy time until they're a little bit older. We can, of course, put a glass ionomer and do a smart technique to make it look white, but at least we're not having the risk of anesthesia so early on. So I think if we get more information out there to our parents, I always say if we could get to the pediatrician, which I, definitely try to do and educate them about, hey, you need to let them know that they shouldn't put them to bed with a bottle and they should start seeing a dentist by their first birthday. And they should actually be using a toothbrush, not just a finger brush once they get those teeth. You can help them not get these cavities so early and also instill in them so they understand that oral health is part of their overall health. And until they really understand that, and it goes back, of course, to medical training and residency training that they understand that. But I'm hoping to see that we will work in this build these interprofessional relationships between us so that we're not in this silo and they're not in one. If there's a question on, diagnoses that they have, what are the oral manifestations from a systemic disorder, let them know that we can see these things and work together. I think that's going to be the best thing for the patients that we serve. And then as far as how practices are growing, yes, we as dentistry, we know we kind of always seem to be following medicine and medicine has turned a lot to like the DSO and the corporate organizations and those small private solo practices may be dwindling down a bit. But I will just share this, and it's my opinion that with the cost of dental education going up higher and higher and higher, these kids are coming out with $250,000 of debt after dental school, and banks aren't lending like they used to. They can't get the capital to start a private practice. So they are finding that, they're going to the group practices and things like that. And I was in a group practice my first year coming out. So I did that for a year before I opened my private practice.
Yeah.
And of course, there are pros and cons to both. If you choose to do that, that's great. The fact that if you feel like you really wanted to do something on your own, but you can't because of the debt, we need to figure out how to bring the debt down or the cost of dental education down so that everyone can have a possibility to reach their full potential.
Thank you so much. How can the ones that are listening to us can know more about your work? How can they get in touch with you or with the Diversity in the Dentistry organization?
Oh, thank you. Thank you. I've really enjoyed this conversation. I'm really grateful for the listeners who are tuning in and, of course, for the work you both are doing. But you can definitely find more information on our website at diversityindentistry.org. And we're on social media, just the handle Diversity in Dentistry on Instagram and Facebook. A little bit of TikTok and into the TikTok so we can get to our students. That's their platform. But also you can connect with me too if you have questions on how to kind of bring in some inclusive leadership skills to your team and help build your team culture. And we're struggling here in the United States with hiring and retaining teams. You can go to my website, which is drlailahishaw.com. Thank you so much.
Thank you so much. It was such an important conversation, and like I said, we usually do not have this kind of conversations here in Europe with in dentistry. We never. I think, Andre, if you agree with me, yeah.
It's true. It's the prejudice concerns and everything. It's just something that is not very. I don't think that we have that much of an issue here in Europe, but maybe we do, and we are not as aware.
Yeah.
So it's always important to listen to this. I
think in the United Kingdom, this conversation it started already, but but in the rest of Europe, no.
Yeah, we need to learn from Europe, right? Now, America, it's a lot of reckoning happening with just a racial tension and things like that, but it has to be discussed. So I appreciate you having the courage to have this conversation. I always say, I hope it touches one person, maybe think of something differently or act differently or change their ways or reach out to someone. The biggest compliment is, when someone heard a lecture I gave, she said, you know what, I started mentoring a Black woman. Didn't look like me. And we have a great relationship. And I'm so excited to say she's starting dental school. That's the reward. And that's what I'm hoping to achieve by sharing the message after.
Thank you.
Thank you so much
for your time. Thank you for joining us.
So great to meet you. I hope to see you in person one day.
Yes. If you come, let us know.
I will. Absolutely. Well, great. Thank you. I'm sorry about the time, but I'm so glad it worked out. And I can't wait to see and watch it.
Yeah. I will. Judge and Day, maybe you stop the recording.
No, I haven't. No.
Okay. I will just want to say that we'll send you an email asking a picture from you and the links that you want us to put on the show notes. And when everything is ready, I will send everything to you.
Yeah, great. And congratulations! I didn't get to congratulate you on your awards and all this stuff. I'm digging through. I'm so glad I finally got to learn more about you guys. I got to get it out to everyone out here.
Thank you. Thank you so much.
Have a great rest of your eating day. I don't know, the rest of your
Thank you.
It's almost over.
Thank you for listening to the Soft Spice podcast. We would love to hear your thoughts on this episode. Please leave a comment or connect with us on social media. Your comments and messages will help us to know you and our profession a little bit better so that we can offer real value in return. And if you like it, please subscribe. If you want to learn how to be a leader and drive change in dentistry, take a look at our Conscious Leadership course at softbites.online.